Flat knit compression garments are usually prescribed by healthcare professional after an appropriate diagnosis. They are available from medical retailers and lymphedema professionals. Let the patient show you the prescription. It should specify the model, compression class, and additional features of the garment. Ideally, you should arrange an appointment with the patient for enough time. The measurement should be carried out after lymphatic drainage on a maximally decongested extremity, or as soon as possible after getting up. Before measuring, you should get an idea of the affected extremity. This includes the condition of the skin, edema, scars, and so on. This should be done through a brief palpation and visual examination. For Sigvaris Group's measurements, we differentiate between 3 forms of circumference measurement. Firstly, the skin measurement, which corresponds to a phlebological measurement and is carried out without tension. Secondly, a light lymphological measurement, which achieves a reduction in circumference by lifting the edema or tissue using the measuring tape. Thirdly, a firm lymphological measurement that achieves a reduction in circumference by lifting the limb using the measuring tape. The circumference measurement can be carried out from measuring points Y to F while lying down and should be carried out for measuring points A, G, H, K, 1, and T while standing. While measuring, it is important to always take the length measurements vertically. Length is always measured on the inside leg. Exceptions are the measurements LK1T and LK2T, which are measured along the contour of the body. Measuring point CA. The circumference of the forefoot is measured in front of the metatarsophalangeal joints, while the foot is bearing the full weight of the body. The measurement is carried out lymphologically. Measuring point LAI. The length of the inside of the foot is measured from the heel to the crease of the big toe. Tip: for a straight ending with an open toe, the length and the measuring point CA should be taken at the crease of the big toe to prevent the garment from slipping towards the heel. Measuring point LA. The length of the outside of the foot is measured from the heel to the crease of the little toe. Measuring point LZ. To measure the length of the entire foot, measure the distance from the heel to the longest toe. This is usually the big toe or second toe. Tip: when it is a closed toe tip, please add 0.5 centimeters to the total length to avoid pressure from the seam on the toenail. Measuring point CY. The circumference CY is measured phlebologically over the heel and instep in dorsiflexion with tense tendons. Measuring point CA1 with anatomical heel. The circumference CA1 is phlebologically measured over the sole of the foot and instep in dorsiflexion with tense tendons. Tip: It is important that all three measuring points, Y, CA1, and CA2, meet at the Y measurement point on the instep. Measuring point LA1 with anatomical heel. The length LA1 is measured from the heel to the measuring point CA1. Measuring point CA2 with anatomical heel. The circumference CA2 is phlebologically measured over the Achilles tendon and instep in dorsiflexion with tense tendons. Tip: it is important that all three measuring points, Y, CA1, and CA2, meet at the Y measurement point on the instep. Measuring point LA2 with anatomical heel. The length LA2 is measured vertically from the heel to the circumference measuring point CA2. Measuring point P1. The length is measured from the middle of the Achilles tendon to the middle of the ankle along the contour without tension. Tip: the middle of the Achilles tendon corresponds to the seam line. The middle of the ankle corresponds to the most prominent bump on the ankle. To make it easier to find measuring points, it is advised to mark the points. Measuring point P2. The length is measured vertically from the floor to the middle of the ankle. Tip: the middle of the ankle corresponds to the most prominent bump on the ankle. To make it easier to find measuring points, it is advised to mark the points. Measuring point CB. The circumference CB is measured at the narrowest point above the ankle with lymphologic tension, tending towards firm tension. Tip: if the patient has lipedema with a muff collar on the ankle, please measure on the collar. Measuring point LB. The length LB is measured vertically from the floor to the narrowest point above the ankle. Tip: if the patient has lipedema with a muff collar on the ankle, please measure on the collar. Measuring point CB1. The circumference CB1 is measured at the beginning of the calf with lymphologic tension, tending towards firm tension. Measuring point LB1. The length LB1 is measured vertically from the floor to the base of the calf. Measuring point CC. The circumference CC is measured at the biggest calf circumference with lymphologic tension, tending towards firm tension. Measuring point LC. The length LC is measured vertically from the floor to the biggest circumference of the calf. Measuring point CD. The circumference CD is measured approximately 2 centimeters below the back of the knee using lymphologic tension. Tip: in there is an excess of tissue. The measurement is taken below the skin fold in case the garment ends there. Measuring point LD. The length LD is measured vertically from the floor to approximately 2 centimeters below the back of the knee. Tip: if there is excess tissue, measurements are taken below the fold if the end of the garment should be located there. Tip for finding measuring points, BD. If B1 and C are difficult and/or impossible to determine, the length between measuring points B and D can be measured and the distance can be divided into thirds. Measuring point CE. The circumference CE is measured at the thickest point above the patella, with lymphatic traction, tending towards firm tension. Measuring point LE. The length LE is measured vertically from the floor to the thickest point above the patella. Measuring point CF. The circumference CF is measured at the halfway point between E and G with lymphologic tension, tending toward firm tension. Measuring point LF. The length LF is measured vertically from the floor to halfway between LG and LE. Measuring point CG. The circumference CG is measured at the thickest part of the thigh below the groin using lymphologic tension. The height of the measuring point CG and the height of the measuring point LG differ from one another. Measuring point LG. The length LG is measured vertically from the floor to the gluteal fold or to the desired end of the garment. The height of the measuring point LG and the height of the measuring point CG differ from one another. The height LG corresponds to the height LK2. Measuring point determination, K1. First identify the midpoint of the upper thigh, then move halfway into the direction of inside of the thigh area. Next, from this point, move vertically upward to the intersection of the groin. Measuring point LK1. The length LK1 is measured vertically from the floor to the groin at the level of the edge of the pubic bone. Measuring point LK1T, a front body part. The length LK1T is measured from the measuring point LK1 to the measuring point CT following the body contour. Measuring point LK2T, backside of the body part. The length LK2T is measured from the measuring point LK2 to the measuring point CT following the body contour. Measuring point CH. The circumference CH is measured at the largest circumference of the buttock using lymphologic tension. Measuring point LH. The length LH is measured vertically from the floor to the largest circumference of the buttocks. Tip: the measuring point LH is higher than the measuring point LK1. Measuring point CT. The circumference CT is usually measured at the upper end of the garment using lymphologic tension. In some cases, such as pregnancy or umbilical hernia, phlebological measurements are carried out in consultation with the patient. Tip: it is recommended to place the upper end of the care in the area above the belly button and under the chest, depending on body shape and stature. Measuring point LT. The length LT is measured vertically from the floor to the top of the garment. Tip: it is recommended to place the ending of the garment in the area above the belly button and under the chest, depending on body shape. Measuring point CX. The proximal toe circumference CX is measured directly above the webbed skin. Each toe is measured individually without tension and with millimeter precision. Tip: the webbed skin of the toe must not be squeezed or pressed down. Measuring points CEZ. The distal toe circumference is measured with open toes in the middle of the nail bed. Each toe is measured individually without tension and with millimeter precision. Tip: in the case of osteoarthritis, thickening of the joints, measurements must be taken across the joint. If the circumference CZ is larger than CX, the circumference CX must be adjusted to CZ. Measuring points LZX. The length LZX is measured from the base of the web, the measuring point CX, to the middle of the nail bed, the measuring point CZ, or the desired end of the toe. Each toe is measured individually and with millimeter precision. Tip: the little toe is only stocked in exceptional cases when edema is present. Measuring point CA. For circumference CA, place the measuring tape along the path from the flexion crease of the little toe to the metatarsophalangeal joint of the big toe. The tape should run diagonally over the base of the toes. Take the measurement without applying tension and with the full weight on the foot. Measuring point CA1. For circumference, CA1, the measuring tape runs over the metatarsal bones and the highest point of the back of the foot, positioned at a right angle to the foot's long axis. Take the measurement without applying tension and with the full weight on the foot. Tip: mark the measuring point A1 on both the outside and inside of the foot for measuring LAA1 on the outside and LAA1 on the inside. Measuring point LAA1 inside. The length LAA1 inside is measured from the lateral marking point CA1 on the inside of the foot to the base of the big toe, specifically to the flexion crease of the big toe. Measuring point LAA1 outside. The length LAA1 outside is measured from the lateral marking point, CA1, on the outside of the foot to the base of the toes, specifically to the flexion crease of the little toe.